In respiratory tract infections, several factors should be addressed simultaneously. Usually there is an infection with a pathogen, in many cases with the Chlamydia bacteria, the causative agent of ornithosis. In addition, the environmental factors / the loft climate should also be taken into account, as poor ventilation and too high a humidity level in the loft can also be disastrous. Do you notice the following symptoms in your pigeons? Then the alarm bell should ring immediately. The nose cere and eye rims are slightly discolored, and not chalky white. The heads are no longer nicely smooth and streamlined, and the ears are standing straight up. The eyes are a little wet and slightly inflamed. The pigeons frequently scratch their heads with their feet. The pigeons open their beaks a lot and they seem to be yawning. When training, pigeons land on the roof with their beaks open. In worse cases, pigeons rattle and have respiratory problems with the slightest effort. Do you notice these problems with your pigeons in the run-up to the season? Then treatment becomes essential. In case of ornithosis, you can treat the pigeon with a suitable antibiotic based on doxycycline. Ask your vet for more advice. Respiratory diseases. Respiratory diseases are very common in pigeons and are the main cause for poor performance and pigeon loss during the racing season. The classic symptoms of respiratory infections include mucus in the throat, open beak, and heavy breathing, rasping or gurgling while breathing. Another symptom is a watery discharge from the eyes, sometimes associated with swelling in the eye area. Other symptoms include discharge from the nasal area, and occasionally air sac swelling or crop swelling as torn air sacs trap air under the skin. As is usually the case with pigeons, other diseases can quickly manifest themselves when birds are in distress, so other symptoms can occur, such as loose greenish droppings and loss of weight. Most often the only noticeable difference in our birds will be their unwillingness to fly, or their complete failure in the racing events. To prevent and control respiratory infections, maintain adequate ventilation, without drafts, in the loft. Keep dust and ammonia levels low, which means not allowing droppings to accumulate. Control dampness and overcrowding. It's also wise to limit contact with wild birds, since tests have indicated in some areas that as much as 70% of the wild pigeon population is either carrying or is infected with a respiratory disease. Typical infections include chlamydia and ornithosis. Chlamydia. Chlamydia is a microorganism that is found within the system of many pigeons all the time. It is the principal cause of respiratory infections in pigeons. There are many different strains of the organism, and while lofts can have resident strains to which their birds may have developed immunity through constant exposure, contact with other birds, strays, races, new introductions, can bring in new strains. Stress within the loft can also cause dormant chlamydia to flare up. Stress causes the organism to spread through the body and cause damage to a variety of organs including the respiratory system, liver, bowel and ovaries. The respiratory system is however the usual site. The introduction of any other disease into the loft can also leave the bird vulnerable to a chlamydia flare-up. Symptoms: air sac infection, nasal or ocular discharge, rough plumage, tremors, lethargy, progressive weight loss, occasional conjunctivitis, high levels of urates in droppings, dead in-shell youngsters. Ornithosis. Ornithosis is a contagious disease originated by chlamydia. The bacterium Chlamydia psittaci are discharged in the lacrimal fluid, droppings, beak and throat mucus and the crop milk. Birds infected by ornithosis become the carriers and discharge the pathogen. The birds contract the disease by breathing in dust having the pathogen, by ingesting contaminated feed or water and by billing or feeding their young. You will see often this disease during the molting season when the quantity of dust rises in the lofts due to feathering changes. Over 65% of young birds have problems with the ornithosis complex. Symptoms of ornithosis: one-eye blinding, lack of condition, nasal secretions, decreased desire to fly, inflammation producing itching and pain which leads to scratching of the head and beak, swollen eyelids and wet eyes, sneezing, rattling and coughing, discolored wattles. For treatment of respiratory problems in pigeons, like ornithosis, mycoplasmosis. Description: doxycycline, a slow-acting, wide-spectrum tetracycline, has a great affinity with lung tissue and is therefore recommended especially for bacterial infections of the bronchial tubes. Doxycycline is assimilated quickly and completely, penetrates tissue effectively and in this way is an ideal drug for the treatment of bronchial infections. Indications: ornithosis, mycoplasmosis. Respiratory problems in common. Medpit, Doxibiotic 200 grains for flock treatment of psittacosis/ornithosis and bacterial infections in racing pigeons. Doxycycline is the golden standard in the treatment and prevention of psittacosis/ornithosis. Vitamins included in the formulation to enhance recovery. In confirmed cases of psittacosis, treatment must be given for 40 days and supplemented with Medpet and Taro plus 3 times a week to replace beneficial gut bacteria. Can be used in the water or soft food. Safe to use, even for extended periods. Composition: use only as directed. Add 5 grams, 1 heaped measure, included, to 1 liter of drinking water for 5 to 7 consecutive days. Change medicated water daily. Size: container 200 grams. Prevention: the most important aspects in controlling respiratory infections are adequate ventilation without drafts, keeping dust and ammonia levels low, which means keeping droppings from Gathryn, and controlling dampness and overcrowding. Contact with wild pigeons should be limited as nearly 70% of this population have been shown to be either infected or carriers. Always treat with effective drugs for the recommended length of time. Proper quarantining of new birds is also a must.